Thank you for joining us. My name is Rob Purdy. I'm one of the co-founders of MyCARE Foundation. The unique thing about MyCARE is we are devoted to helping patients battling fungal infections as well as their families and caregivers. And because fungal infections as a group are so rare and so underdiagnosed, we felt it was important rather than focus on one specific disease to bring the community together and talk about how much, no matter what fungal infection we have in common and with some of the issues that we face. So I was diagnosed with valley fever or coccidioidomycosis in early 2012. So my diagnosis was actually as a meningitis. I spent I was lucky that it only took 6 weeks to get diagnosed with meningitis, and then proceeded to spend about the next 30 days in the hospital. Um, Spending the majority of that time promising my wife and my kids I was going to be fine, and was finally released from the hospital. Still had a huge, um, all-consuming headache that lasted until about May. Um, Ended up back in the hospital in October when I failed the first drug, fluconazole. Subsequently failed two other oral medications and was put on amphotericin plus an oral medication. Failed amphotericin and the oral medication again. So I'm on my fourth oral medication and have needed sporadic amphotericin treatments for the last 9 years. But with that combination of therapy, I've been pretty stable and able to have um, not a normal life and not the life I had, but a good life. So we have two couples here with us this evening that are going to share their experience with fungal meningitis as well, and really the chronic aspects and lingering aspects of fungal diseases. So, Jessica, I'm going to ask you and Brian to speak first. If you can, just give us a 10,000 foot view of what it is that you've been battling.
Yeah, absolutely. Thank you for having us. I am Jessica Bader. This is my husband, Brian. Hello. Um, so I contracted valley fever in late 2023. I do live on the central coast of California in a pretty dusty, windy area. So it was kind of the prime area for that to happen. I was also in my third trimester of pregnancy. So with my second, so very immunocompromised. Initially thought it was your standard colds, maybe flu, went to urgent care twice. They did sense a little bit of pneumonia, so they gave me some antibiotics. Nothing was working, of course, and then went into the ER December 31st, 2023, so spent New Year's Eve there. Thankfully, the ER doctor there pretty immediately knew that it was valley fever. They took the blood test. Within a couple days, that came back as positive. But what did take a couple more days was my constant complaining about my headaches and incredible neck pain. Finally got a lumbar puncture to test for meningitis, and it did come back positive. So here we are. This last July, I did receive a little bit of a complication, if you will, in that I was experiencing symptoms again, but really only when I was going from sitting to standing or from laying to standing, and that it was almost like having neck contractions. I was vomiting as well. My legs were giving out, and it turns out that the natural valves for cerebral spine fluid were clogged. So I ended up having a brain surgery, nothing by comparison to your guys' story. My goodness. A brain surgery at this point to have a shunt placed for life. So that is the 10,000 foot view. I'm medicated on posaconazole, was fluconazole. I was fine with fluconazole, but my doctor changed it just in case I wasn't reacting as well as I should have at this point. So.
Yeah. Thank you for sharing that. Jenny, do you and JP want to kind of give us a real quick hierarchy of uh, your journey so far? You're muted.
Are we? Oh, here we go.
You're good now.
Yeah, I also had severe headaches, and I don't think I ever was diagnosed with meningitis, right? And they did like 20 of these lumbar punctures on me, but it never came back. They were always taking out fluid because I had the same issue. My brain was, I guess, being compressed with all the fluid, but it helped, but it hurts. And you get used to it. And then they put me on this continuous pump, and then they ended up taking too much out of my brain, and then my brain was didn't have enough to float, so it was sagging, and that gave me seizures. So it was an interesting journey for sure. And it took a little longer to be diagnosed. They had to open my head to figure out that there was fungus in there. Think it was from, I think I spent Halloween in the hospital. So,
November.
so I was in the hospital from October, November, and it wasn't until December that they found the fungus. Um, and then they ended up sending it to Washington University to do a DNA test, and that was when they confirmed it was this rare type of fungus in the Mucor family.
Hmm.
So it took a while. We didn't know what it was. The doctors didn't know what to do other than just sit there in the hospital and keep me alive.
An interesting thing about his story too is that this mold is found in tropical climates, and we live in North Carolina. And another thing that was quite odd is that they tested him for everything. Now they're doing a genetic testing, but and I guess they can say it might be genetically predisposed, but he's 40. How old are you? He was 42 when this happened and never been in the hospital a day in his life. And so not only is it rare that we have this mold, maybe possibly in the soil. I mean, it's a soil, it's a mold, but in the mulch, they are saying, maybe because he mulches, but also that he was perfectly healthy and how it spread to his brain. I mean, yes, it was delayed, the diagnosis was delayed, but I mean, everybody, I mean, he's perfectly healthy and he still was for it to spread to the brain. Now they are saying it's either because of a sinus infection, which he didn't have because he had sinus infection. This was not a sinus infection, or a tooth that he didn't take antibiotics for. I was supposed to get a root canal, stop hurting. So not taking his antibiotics. And like 3 months before this happened, it could be that as well. Nobody, I mean, there are multiple theories, but what we're hearing is that it's just bad luck, and we'll probably never know. And it's like getting struck by lightning, and um, just bad luck.
They were adamant that I had gone to India or China.
Yeah.
That's where the fungus is found. But I've never been there before.
And that's what makes it so hard is that there's really only 5 reported cases of this. And so for them to, the only roadmap was literature. And so it was just, we all were just working and learning together as we went. I mean, we didn't have anybody. Now it was just, oh my gosh, the struggles I went through just to try to find somebody who had, one patient, just anything, even just the Mucor. I'm a healthy person. I mean, I know it happens. Usually people get this fungus with transplant, and what else is that one? Oh, if you have diabetes or any kind of, actually, if you're immune compromised, JP wouldn't be with us right now. There's no way he would be with us right now. The fact that he's perfectly healthy, how'd you get this? The fact that he's perfectly healthy is why he's here today. So it's just like this very just, I mean, bad luck, which it just sounds, and people are like, oh no, you tell us really. And we're like, we don't know. I mean, and the doctors at NIH say just maybe in 20 years when the technologies catches up. Actually, the doctors at NIH are bound and determined to figure this out. But then he's also recognizing that after he does all these different types of testing, like a bone marrow biopsy he had last week, you know, we may never know. He thought at one point it might have been multiple myeloma and it wasn't Mucor. It must be cancer because there's no way it could spread this. I guess his skull bone is the most, I don't know what it's called when your skull bone's infected, but that's the worst part right now because it takes forever for it to heal and medicine doesn't penetrate it very well. And you can't, you know, debride his entire skull.
Yeah.
That's the hardest part right now for him. But I mean, we may never know, which is, I think, the hardest part of this all is
Yeah, for sure.
you don't know.
So you were in the hospital, JP, for almost 60 days before they were able to diagnose you.
Yeah.
No, not that long. October 28th, we went to Novant. November 23rd, we went to Duke. December 4th is when they did the biopsy, and they knew at that point it was fungus because they could see that substance. I don't know how long that is, 35 days maybe. And then he was in the hospital for 76 days the first time, went home in February, and then 71 days the second time.
So besides multiple myeloma, what did they think they had? I mean, how long was it before they said the word fungus? Was it not until that you got
Biopsy.
those results from biopsy results from?
Yeah.
Because in their defense too, at Novant, we were not going to, I mean, these are great hospitals. I mean, Duke is a great hospital, but nothing was showing on the MRIs. He had MRIs after MRIs, and only thing they could see this little fat piece of fat up here. And so this really curious neurosurgeon who we owe everything to because he took the risk on Christmas Eve to do this very scary surgery is that he was like, I wonder what that is. Let me just go do a biopsy. And they didn't know until they opened him up, like, what is that? They did not think they were going to see this white, chalky toothpaste stuff. And that's when the whole thing like I said, it got really bad very quickly.
But it was a while though, to
Yeah.
answer your question.
Sorry.
Yeah, no. And Jessica, how long did it take them to say valley fever for you?
When I went to the ER doctor knew pretty immediately upon me testing negative for absolutely everything else. So he couldn't say officially before the blood test, but he knew immediately that it was valley fever. And then fungal meningitis
When was the first time we went to urgent care?
Oh, urgent care. I mean, I had gone to urgent care like 2 weeks before going into the hospital.
That's fairly,
Yeah.
that's uncommonly short for valley fever. Had you heard of valley fever? You and Brian?
Yes, I have.
I had not. I'm not from this area. I grew up in Boston, and it reminds me a lot of Lyme's disease, just in, at least when I was growing up, like kind of this thing that everyone was getting. Nobody talked about it. Nobody really knew how to deal with it, but certainly come to find out, it's very common here where we live. And, you know, it is a little disappointing that not a single medical professional that we saw during her whole pregnancy even warned us once, like, hey, there's this very common disease. If you're pregnant, it's devastating, so you should stay away from it. The first time I'd ever heard that the valley fever mentioned was in the hospital, likely when she'd already had meningitis.
Uh-huh. Jessica, when you'd heard of valley fever, did you know anything about how severe it could be? I mean, I had heard about it too, and I had no idea.
No, I hadn't even like heard the term valley fever since, like I said, like the early 2000s. I know it's been around forever. So definitely didn't, occur to me that that's what it could be. Like, no OB, no primary doctor, my midwife, urgent care, nobody mentioned the possibility of valley fever.
How long did it take you to get your test results back once they drew the blood and had a suspicion?
3 days.
3 days before.
Yeah.
Jenny, obviously you guys have a rare disease that JP's one of 5, so I'm not going to ask you if you've heard that. But let me ask you a little bit different question. Had you guys heard of fungal diseases? Did you know that was a thing? I mean, I'm not talking about toenail fungus.
No. I mean, the stigma behind it too is, oh, you have mold in your house. That's what I always just thought. Like if people, I mean, that's what you think when you think of.
Yeah, like mold.
Yeah.
Right? Yeah. Okay. And once they did the biopsy, how long did it take to get those results?
There is suspicion. I think they put us on, you said that name, whatever drug they put you on starts with a V. What's that called?
Oh,
They,
not put VFend or
or the I, whatever, I don't know what it's called. They put them on that at first. And
oh, itraconazole.
yeah, and then once we got the DNA results, we knew that it was
Yeah.
resistant to that. So we had to change, but amphotericin didn't
Mhm.
probably mid-December. So we were on the wrong drug
Yeah.
when it did come back. Because we sent this thing away for culture now.
Mhm.
I'm just gonna guess around 20 times because all the aspirating, the surgeries, nothing has ever grown, ever. Only reason why we know it's this species and
It's
this
because of that DNA
because of that
test.
DNA test in the beginning.
So when I was hospitalized, I had daily lumbar punctures, and I didn't have a pump, but they actually put what they called a pigtail in, and so they would actually, because one of the things they do with meningitis is they have to control the pressure in your skull to limit the damage done by the disease. So the only way to do that is to remove CSF. Um, so not for an award or anything, but how many LPs, Jessica, do you think you had?
I've only had one.
Wow.
They should have taken the second one when she had hydrocephalus, but they did not.
Well, probably because when they installed the VP shunt, they were able to measure her pressure. I'm assuming that's what it is. JP, you've had how many?
I don't know. I lost track at 20.
Yeah.
Yeah, I have had at least that many as well. And so that's kind of gets into the difficulty in managing this disease. So I failed three pills, three oral medications. They're all cousins. They're called azoles or triazoles. And they're the only oral medication used to treat fungal disease. I failed fluconazole. I failed itraconazole. I failed voriconazole, and then I was put on a drug called amphotericin that we're all familiar with. Um, that is the drug of last resort, and that plus an oral medication worked. But then I also had issues with the amphotericin. And so I technically failed that. So with that drug, when you fail it, there's no, okay, we'll do something else because there is nothing else. So failing the drug means managing the symptoms that cause you to fail. And so, JP, you're still on it, right?
Yep.
10 months.
So matter of fact, when was the last time you had amphotericin?
He's on it right now.
5 minutes ago.
Yeah. He has it in his IV right now.
Yeah. So you're very familiar with it. What is the biggest difficulty that you've had, you think, with your care management? Is it the IV ampho? Is it the kidneys? Is it the drug, the resistance? What do you think's been the biggest challenge to your care?
To my care, I think it has been the administrating it and having to do it daily. It's a burden on everybody here at home, and a burden on me because it's like I'm plugged into the machine for 5 hours.
Mhm.
But from a quality of life perspective, changes like your palates. Like I can't taste food. Like I eat food just because I treat it as medicine because I have to eat. But there's like nothing tastes good anymore. And I think it's a side effect of the medication.
And his ankles are extremely swollen. His kidneys aren't doing great. So with the anemia, his ankles, it's hard to walk. His hands swollen.
Yeah.
He gets sick. I mean, it's a horrible drug. I mean, it's a life-saving drug. We love the drug, but
Mhm.
mixed
Yeah.
emotions.
It's hard. None of the drugs are really great. I mean, Jessica, what about for you? I mean, dealing with valley fever, which is because once you have it as meningitis, the standard of care is medication for life. So what you were on one drug, what was that like? And then what about what's the biggest challenge that you have in your continued care, getting better, treating, being taken care of?
Um, oh, I will say that I've been lucky and my body has been receptive of both medications that I've been on. Again, my body was receptive to fluconazole, we think, for the most part. His only thing was maybe, it was clogging, or maybe not as receptive as we wanted it to be. I'd say the most difficult part for me is kind of the overall worry that I do have this for life, and management of it all as a whole. I mean, as mentioned, I was pregnant with our second. So I was going into being a mother of now two, at the time under the age of 5. I do work full time. My energy levels are not really where they are, and I don't really know what to blame for that. I do take a ibuprofen every single day because I do still get recurring headaches. So, I manage. I think all in all, though, my case was luckier than most.
So you were on how much? What was your initial dose of fluconazole?
400 milligrams.
Okay, and what is
Now
your
I'm on 300 of posaconazole.
Okay, and did they ever increase your dose of fluconazole, or was it always 400?
It was always 400.
Okay, did you have side effects with that?
Hair loss,
Mm-hmm.
I think. But I was also postpartum, so it was like double whammy. I do, yeah, definitely hair loss. So I was kind of lucky with skin. It didn't really dry out my skin too much. So I think that's the primary. I was getting pretty nauseous at first too, while taking it, but that's since kind of stabilized.
Yeah. Do they check your kidneys and liver function and all of that?
They do, yeah.
And so far, so good.
Every like 2 to 3 months, get my blood tested, and then luckily we have an infectious disease specialist here on the Central Coast, so I go and see him every 2 to 3 months, and everything has been good.
So to tack onto that, this is 2 months, almost 3 now, away from brain surgery, as you just had. So it's not Jess is really good at painting a really nice picture, and it's admirable, and I think helps. But it's also, to be realistic, it's just the unknown. We don't know.
Yeah.
That's the hardest part, is when you're on something for life. It's something that you always have to think of, and there's gonna potentially be other side effects that you just have to always watch out for.
Mm-hmm. Yeah, like I said, the worry. It's a lot.
So Brian, I mean, when you explain to people what's going on with Jessica, do they know what you're talking about? Are they surprised? Are they supportive? I mean, what kind of response do you get?
So that's a really good question, because it goes 2 ways. It really goes 2 ways. One is, yeah, my close family member got it. It was really bad. They're in the hospital for a long time, and it, changed their lives. And then the other side is just, oh yeah, it's like, I heard you can get sick from it, but I didn't realize it was that bad. So I think that's kind of the gamut. Most people here have heard the name. They don't know what it is, how they get it, other than it's in the air. And I think especially around here, like, people just assume that if you're not in construction or ag, you can't get it, which is definitely not true. But I think that's really interesting to me anyway, where it's like, it's either yes, like I know what this is and it's extremely dangerous and you have to be careful, and then the other side is just, I wouldn't call it ignorance. It's just not knowing, or maybe not having come across it in the way that
not having that personal experience.
Yeah, exactly.
Mm-hmm.
And Jessica, just to be clear, you don't do construction?
I don't. I was not at 7 months pregnant working in construction either. I think I was maybe walking my dog or something, and I breathed in a spore.
So I didn't work in construction either, and I got it. And I also heard, well, if you live in Kern County, you live in Central California, you've had it. It's not nothing to worry about. I grew up here. I've already had it. Well, how do you know that? That's one of the things that I heard a lot. Jenny, obviously, it's a different thing for you. what is when you try to explain to people what's happening with JP? What kind of response do you get? And do they comprehend what's going on?
No,
Like as a family?
I think the biggest thing is how to get it.
Mhm.
I don't know. How do we prevent, of course I think just human nature, like, well, we don't want, how can we prevent getting
Mhm.
them? Like, we don't, and it's hard because I'm in like we're still in
Mhm.
the grind, but it is not frustrating, but like almost like I'm not being truthful. I'm like, I promise I would tell you. I promise if I could protect you from inhaling this particular mulch, I will make sure I let you know. We really don't know at this point what it is. That's why I'm hopeful that maybe NIH will figure it out. But that's the thing. What I do know is that JP, because he's been tested for every single thing, he doesn't have any underlying conditions. So that's nice because a lot of people just go their whole lives not knowing that. I guess he knows that he doesn't have anything. But really it's hard because I'm like, not that I have to prove to anybody, but it's just, I think the fear of it happening to them or somebody they love, I wish I could offer something else as a solution to how you don't get this. But this is just so rare that I mean, we just don't know at this point. And so I think that's what it is. I mean, of course, everybody is, um, even me. I'm always think sometimes I'm talking about somebody else. I'm like, this is not happening to my loved one. This is not happening to our perfect little family. And so I think for our loved ones, they're still processing everything too. I mean, JP's still very much living this. So it's hard in this phase of our journey. Um,
So let me ask, so you guys are dealing with an extremely rare infection. Do you have concerns for yourselves, family members, or your kids getting this infection? Or have you come to the realization that it's so rare that you just can't?
Well, it's funny that you say that because last time we were at NIH, last week, September 4th, whenever, or 2 weeks ago, he's like, I'm going to figure this out. This is when the bone marrow was still pending, the results, biopsy was still pending, but he said he's determined to figure this out. I'm not, again, the genetic testing is still being processed, but if it does come back, which would be, I don't know, so many mixed emotions I have about that thought too. But if it does, he's like, I want you to bring your kids out here so they can get tested too. And so, yeah, I mean, absolutely. If it is something genetic, that would be great. Because I have an answer finally to this, hell we've been living. And also, I mean, he hasn't been sick for 42 years, but I mean, if my kids do have this genetic predisposed to this particular rare fungus in tropical climates, I mean, I guess it's good to know, but again, the chances of that, I don't know. It's just, I don't, and again, he said maybe in couple years when technology catches up and with the climate the way it is right now, he thinks there's going to be more cases of this, but right now where we are, I don't know. I don't think I'm too worried.
And if they do find something genetic, then you can at least take precautions and warn your children,
Absolutely.
make them better
Absolutely.
advocates.
Yeah.
And it's kind of the opposite side, I think, for Jessica and Brian because they live in an area it's a regional disease. So do you guys worry about your family and your children?
Certainly, yeah. Especially, just considering like how bad it really got, how painful it was. It's not to the point of like we would consider moving away from the area. I feel like everywhere has something that's going on. But if anything, it's like it's not a good thing by any means, but definitely know what to look for and what to push for if one of our little ones or even Brian, like he had a cold one time and a cough that just wasn't going away. I'm like, go get tested for valley fever. Can't hurt.
Mhm.
So yeah, it's a lot of you have to advocate for yourself, but I would know what to look for.
My wife had a persistent cough that lasted 3 months about 7 years ago. and she was tested for valley fever 3 times, um, because the doctors and because she advocated, and it's, one of those things. It's like, okay, I tested negative for valley fever, but I'm having a condition. Keep looking for an answer until you can give me an answer, right? And that's the important thing, is not to take an assumption.
Right.
Or, when the antibiotic didn't work, it's not okay. Just keep throwing pills at it. We need an answer. Um, so, obviously, there's a big difference in the amount of treatments and drugs that we've had to deal with. Um, when it comes to improved care or improving your outcome, what would you like to see available? Is it resources? Is it better diagnostics? Is it better drugs, awareness? I mean, Jessica, what would you prioritize?
Definitely awareness, for sure. Again, going back to like the fact that not a single doctor, midwife, nurse, nobody brought up the possibility of valley fever to me as a pregnant woman going into the fall season. In our area, it is so more and more common that it feels like it should have been mentioned by somebody. But also to have gone to urgent care twice, if that first PA who was there, if it had crossed her mind that, I'm negative for everything else, COVID, flu, all the things, maybe she should go get a blood test for valley fever, that probably would have saved me from getting meningitis.
Certainly would have changed the course of your care. And,
Absolutely.
and I know, Brian, you reiterate the importance of awareness. For JP and Jenny, I'm not sure if it's going to be the same answer, but I mean, what would you think is the biggest need for patients battling fungal diseases? Awareness, education, resources, diagnostics, treatments, physician knowledge. I mean,
All of it. All of it. I think that the biggest thing for us is thinking outside the box, and in standard of care, it needs to not be, even to this day, I'm like, by this time we cannot do standard of care for JP, but I just think that it's what, it's you follow the books, you follow the literature, you follow, and that was hard. Plus, I mean, it's nobody's fault. This is extremely rare, but I just think that repeating like so many times we're doing the same thing over and over again. We have to just do something different. And I think the biggest eye opener for me, and I think I maybe mentioned this a little bit to you, Rob, is not everybody gets invited to NIH. I mean, I was persistent. When I say I wrote an email every single day to every single person who ever had experience with this fungus, NIH being one of them. I can't tell you how many people I reached out to, even people from India who wrote the literature, never got a response. But people don't, have that time, or, I mean, I'm also just persistent, like I said, and if they didn't have our genetic testing already in the mix, Duke did that, and Duke initiated that, and already knew about JP's case, that we wouldn't have had this. The biggest thing right now is that whatever that is, GMCSF, which is an injection in his belly every night, that apparently is doing wonders. And this new drug SF001, like a lot of people wouldn't have this opportunity. Now, am I upset that we're 10 months in? I mean, not upset, just, the what ifs again always kind of creep back in. But not everybody gets invited to NIH.
Yeah.
And so that's the hard part, is I don't know where JP would be right now if he definitely would have a kidney transplant because the amphotericin. I mean, we're getting to that point where that's where we're headed.
Yeah, and SFO001 is a new version of amphotericin without the toxicity.
Yeah.
And it's as horrible. Amphotericin is a drug that was developed in the 1950s, and it's a toxic, terrible drug, but it's the most effective weapon we have. But it's a bit like a nuclear bomb. When it goes off, there's nobody that's not harmed, whether it's the fungus or the host. but I think having access to more drugs is certainly needed,
Yeah.
and better drugs. You, Jenny and JP are struggling with finding a combination that can kill the fungus. And Jessica and Brian and I are dealing with the fact that there is nothing that does kill the fungus. We just have to hold it still and hope our immune systems can beat it up, and control it. So, um, I always want to ask, what would you tell people that are, newly diagnosed or think they might have a fungal disease or are worried about a diagnosis? And I'll start with what I always tell people, which is, valley fever and fungal diseases are rare diseases. So they don't always need to be the first thought. But once you have that first thought, that first diagnosis, that first course of antibiotics, and it's not working, it's not another course of antibiotics. It's not doubling down on what didn't work. It's thinking outside the box. It's thinking bigger, asking for a test, pushing for diagnostics that include fungal. Um, you know, Jessica, Brian, what would you advise somebody that's either at risk or newly diagnosed or worried about being diagnosed?
Yeah, very similar. I mean, absolutely. I always wonder about people. We live in a very touristy area, kind of wine country here. People come in from all over the world, but all over the country too to visit.
Mhm.
And the fall season is absolutely gorgeous. So it's like if you are immunocompromised in any way, or even if you're not, and you come to visit, and then in about 2 weeks start to have a cough, and it's incredibly, it's not going away. It's starting to get worse. Then yeah, I mean, advocate for yourself to get tested for things outside the box that your doctors are probably not going to think of.
Yeah, I think my learning lessons, as somebody who's just witnessed it, is that yes, fungal diseases are rarer than bacterial viral diseases, but they are no less dangerous. In fact, probably more dangerous because they're not getting treated until well after you get it. So for me, it's eye opening to see how far we still have to go against fighting fungal diseases comparatively to the bacterial and viral diseases, again, more common. But when you add up the collective total of all these fungal diseases across the country, whether they're super rare or common, it's a gigantic number. It affects a ton of people. And if you don't have the will of the presence of mind to advocate, push to get tested for it, probably not going to get found. And that's obviously very dangerous.
And you said the magic word rarer. So we know fungal diseases are vastly underreported and underdiagnosed, but we know there's about 75,000 hospitalizations a year in the United States for fungal diseases. Um, so we know they're rarer does not mean rare, as a group. Um, Jenny, JP, what would you want somebody to know?
And those are the ones we know about.
Mhm.
But we suspect that there's more undiagnosed people suffering from fungal disease.
Mm.
So it might not be rare, it just might not be
Yeah.
diagnosed because the standard of care doesn't call it for it. The diagnostics is not where it needs to be on this stuff. And then the medications are limited, right? Like you said, there's only a couple options for this stuff
Yeah.
once you get to the diagnosis. So I don't know, better medication and different diagnosis.
Uh-huh. And I will say to Jenny and Brian, you guys are a testament to the impact that advocating for your family member has on their outcomes. Um, you know, both mental health and also just, Jenny, for you, just pushing and pushing and ending up at NIH, where they're doing great work. And obviously, because it's both a clinical and a research facility, you can sometimes find opportunities for care that you wouldn't otherwise have. Um, so, is there anything else that Jenny and JP, you guys want to share with us as we wrap up?
Mhm. No, I think we've touched it all. think we're grateful for NIH and the work they do.
Grateful for you too. I mean, just to again be part of this that never in a million years we even knew existed. We just didn't know. I mean, and
Just
it's
going about our life.
yeah, and we talk about ignorance, and boy, were we ever. We had no idea, and just um I don't know. I mean, what I keep hearing is that this is not gonna get any better. And if we don't start doing, I mean, I can't even imagine my worst enemy, which I don't ever having to go through. This is, it all could have been prevented. If we would have, in November, perfectly healthy guy gets on amphotericin, we wouldn't be here right now. We wouldn't be 5 brain surgeries later, 70 pounds lighter. I mean, PTSD, I mean, the emotional drain, I mean, we weren't here all year with our kids I mean, my one kid's in middle school now, last year of elementary, like we missed the entire year. Grandparents had to take care of them. Like such a horrible thing that could happen to any family. And it's hard for me to just think about, gosh, what if, and we were in hospitals, we were in the ER, we were at our PCP, we went to Wilmington Eye. Oh, sorry, I'm not trying to, I mean, everybody did standard of care, but we really did. I mean, for it to be told as polyp surgery that he needed. I mean, just I don't know, the what ifs. I mean, I think this is going to make us all stronger, better people because it has to, because why else would anybody ever have to go through this? So I feel like there is a greater purpose for all of this, but um man, it's hard not to wonder if we treated this like a bacterial infection. I mean, I mean, we would not be here. So it's just hopefully the good work you're doing, it can maybe save just a couple families from ever having to go through this, just asking the simple questions that we never knew to ask. Can we get a fungal test? I would never even think about asking that ever. And so, I mean, yeah, just spreading awareness that this is not as rare as people think.
Jessica, Brian, final kind of thoughts?
Um, too much. I mean, I do feel like we've been lucky. It was it's like health things. I mean, very unexpected and not the thing that you plan for by any means. It's been a lot. I think on top of, awareness, something I would wish for and hope for is a rapid test. Something that does not require a blood test. It seems a little crazy to me that with all the medical technology out there, there's not something else that can diagnose it a little bit quicker and easier. I think that's a reason why a lot of it does go undiagnosed, is because it does require that. And then pushing for a cure. You never know, Rob.
Absolutely.